Hello,
Hi.
good morning. My name is Dr. Matthews. Nice meeting you. May I please take your name and date of birth?
Is Amy Smith, the 6th of June 1995.
Hello, Miss Smith. What brings you here? How can I help you?
I have a mole on my arm just here, and it seems to be spreading.
Okay. How long have you had this mole?
I've had it forever.
Okay. And when did you notice it spreading or changing?
Perhaps around 4 weeks ago.
Okay. What did you really notice? Is it just getting bigger or getting more lumpy?
No, it's getting bigger.
Does it itch? Is it itchy?
Yes, it's very itchy.
Okay. Have you ever noticed any blood in your clothes, in your sleeve, or any bleeding from the mole?
If I scratch it, if it's quite itchy, then I notice there's some blood under my fingernails after scratching it.
Okay. And have you noticed any spread of this mole anywhere else?
No.
Okay. Do you have other moles in your body that you are concerned with?
Not that I'm concerned with.
Okay. May I please ask, what's your occupation? What do you do?
I work in a bank.
Okay. Do you go in the sun often?
Yes, I go on holiday probably to Spain maybe twice a year for around a week at a time.
Okay. And are you right or left-handed?
I'm right-handed.
Okay. Apart from this mole, how is your general health been recently? That means, have you lost any weight?
No, haven't
How
lost
is
any
it?
weight.
Sorry. Yeah. How is your appetite?
Good.
Okay. Have you noticed any other lumps anywhere else? Say anything in your armpit?
Yeah, I've noticed in my armpit the same side.
Okay. And how long has that been there?
Around 4 weeks as well.
Okay. Prior to this, how's your health been in terms of do you have any medical conditions?
I know nothing.
Are you on any long-term medications?
No,
Okay. Are you allergic to anything you know of?
not that I know
Do you smoke?
of. No.
How much do you consume alcohol?
A little bit, perhaps around 3 units a week.
Okay. Is there anybody in your family with a history of moles or skin cancers?
No.
Okay. Okay. Um, well, we'll have to have a look at the mole and then see what it is and then decide what's the best course of treatment for it. What are your thoughts on this? What did you think it might be?
Well, I had a look online and there are lots of articles, lots of stories about skin cancer. So I'm worried that it could be cancer.
We cannot be certain one way or the other. We will have to have a look first. And if it looks concerning, then we may have to remove it,
Okay.
study it under the microscope. That's called a histology. And then depending on that, we will have to decide what's the best thing to do. And you also state that there is a small lump in your armpit, which we may have to investigate that as well.
Okay. How serious do you think this is?
Well, at the moment, we cannot be certain. We have to remove it, and then if the studies show that it has gone quite deep into the skin, then we may have to take a slightly larger area. And likewise, if the lymph node or the swelling in your armpit is related to this mole here, then we may have to consider treating the lymph nodes as well.
Okay. So do you think it's spread? Did you think it's cancer that has spread?
If the lymph node has cancer cells, then it's quite possible that this has spread to the armpit.
Okay.
But we cannot be certain whether it has spread elsewhere unless we do further tests. That may require a CT scan of the brain, the chest, the abdomen or the tummy area to look for any spread. But we won't be able to know that until we have done a scan.
Okay. So what happens next?
Okay, so we're going to have a look now. Then we will list you for removing that if we think that's concerning. Depending on the histology or depending on what it shows, we'll discuss what's the next thing to do. We will also have a discussion in the multidisciplinary team, which is a team of doctors, nurses, physiotherapists, radiologists, different specialties, who will decide what should be the best thing to do for this.
Okay, that's fine.
And we will keep you updated on this when we have the results.
Okay.
Okay. Anything else you want to ask?
No, that's
Okay. It was very nice meeting you.
fine. Thank you.
Thank you for your time.